This is for the debriefing assignment for Dave and Rob. So the first question is list 3 facts pertaining to Dave's diagnosis. So Dave is a 66-year-old male who had a stroke 8 years ago. He stated that he has aphasia and would like to improve his speech for an upcoming event. And although Dave has been diagnosed with aphasia, I believe further testing is possible is needed for possible apraxia as necessary. So the steps that I suggested would be to complete the WAB and the apraxia for adult assessment. And then list 3 facts pertaining to Rob's diagnosis. So Rob, his diagnosis is he came in for an eval due to weakness in his voice. He also presented with language deficits and memory deficits. So because of this, the action plan was to evaluate Rob in different areas such as voice, receptive language, and memory. Rob's final diagnosis was mild cognitive impairments, Parkinson's disease, and dysarthria. And then Dave's final diagnosis was apraxia and a CVA. The next part was describe Dave's recovery and the progress he has reported. So in the case history, Dave talked about his stroke and how it affected his job and his social life, and it affected what he could and couldn't do, and he's done things like word tap when he tap out syllables or phrases and tap out the words in a phrase, because words can be hard for him. And then they also spoke with his partner to talk about the different, like, where he was and how he's progressed. And they talked about how about a week after he knew that Dave would need a full-time caregiver, and how he had handled like all of their banking and bill paying and things like that. So the partner had to step up and do all of this. So now Dave is still having trouble with word finding, which is unusual for him because he used to have a very large vocabulary. And then it said to also describe Dave's current level of performance, which I did a little, talking about how he has trouble with word finding and how he has trouble doing the things that he used to do and the things that and like word tapping and finding phrases, and he just has a lot of difficulty with communication, especially when there's a lot of background noise. So that's for Dave. For Rob, it says describe Rob's diagnosis and disease progression, if any, he has experienced. So when speaking with Rob, the areas of concern that he had was that that he seems to be losing more of his volume, and things that used to be easy for him aren't as easy as they used to be, such as like his balance and walking, and tasks take a lot longer for him, which was becoming very frustrating. And in terms of communication, he finds that it's hard for him to be loud enough for people to hear. And so because of that, he feels like he talks a lot softer and things like that. And then it was about 8 months ago when he started noticing the symptoms. What he noticed were tremors in his right hand and drilling on the left side of his face, and overall weakness and muscle soreness and stiffness at times. So then he went to the doctor, and then the doctor said that he may possibly have Parkinson's. And then a couple weeks later, he was immediately diagnosed with having atypical Parkinson's as well as memory loss. And then from then, he says that he's had a runny left eye, and it kind of puzzles him because not sure what's really related, if it's related to Parkinson's or not. The next question is, both clients have had life-altering medical diagnosis. What is your role as a counselor with both of these clients? So the role as a counselor for both of these clients would be to speak with them, speak with their family and their loved ones, see what their expectations are for therapy, what they'd like to gain back, what activities they used to do that they enjoyed, stuff that we can implement in therapy, such as Dave enjoys gardening. So those could be activities that we could bring into the therapy room to help him with his expressive language and give him strategies for word finding and things like that. And then also helping Rob with his memory loss, giving him different strategies to use. So when they're out there interacting with other people, they're able to use these strategies and lead on a more typical day-to-day life. Oh no, my computer just died. You gotta be kidding me.